Specimen collection, sputum, blood, urine, and stool samples. 1. Sputum collection. Scenario 1. Sputum collection by patient's self-expectoration.
Respiratory ward, 7:30 a.m. A 68-year-old male inpatient with suspected pneumonia is ordered for sputum culture, gram stain, and AFB test.
Good morning, Mr. Harris. I'm your nurse today. Dr. Chen has ordered some sputum tests this morning. We'll be checking for bacterial infection and also for tuberculosis with an AFB test. To get accurate results, we need a deep sample from your lungs, not just saliva.
Okay. Do I just spit in the cup?
Yes, but not right away. I'll walk you through each step. First, this is your specimen. Cup. It's sterile, so don't open it until I tell you to. I've labeled it with your name, date of birth, and ID number. Now, I'll explain how to bring up a sample from deep in your lungs. Try to take a deep breath in through your nose, then exhale slowly through your mouth. Do this 3 times. On the 4th breath, take in a deep breath and then forcefully cough from your chest, not just your throat.
Got it. I'll try.
You may need to do that a few times to loosen up the mucus. I can give you a glass of water to rinse your mouth before you start. That helps remove food particles and saliva.
Thanks, that helps.
Once you're ready, open the specimen cup without touching the inside. Spit the mucus directly into the cup. It needs to be thick and yellow or green, not clear or bubbly.
Patient coughs, spits into the cup.
Great job. That looks like a good sample. I'm sealing the lid now. This will be sent to the lab within 30 minutes. Let me document everything first.
SBAR report to doctor.
Hi, Dr. Chen. This is Nurse Kim from the respiratory ward calling about Mr. Harris in room 312. Just wanted to let you know we collected his sputum specimen at around 7:38 a.m. this morning. He's the 68-year-old male with suspected bacterial pneumonia and possible TB. You had ordered a gram stain, sputum culture, and AFB test. He was able to produce a good quality sample through self-expectoration after proper instruction. The sputum was thick and purulent. There were no signs of hemoptysis or respiratory distress during or after the collection. We'll continue routine monitoring and send the sample to the lab right away. I'll update you once results are back or if anything changes.
Thanks for explaining everything. I didn't know the difference between spit and real sputum.
You're welcome. It's important to get it from deep in the lungs so we can find out what's causing the infection. You did great. I'll follow up with you when we get the results.
Scenario 2. Sputum collection via suction in an adult patient.
Pulmonary ward, 6:45 a.m. A 74-year-old female patient with COPD exacerbation is unable to expectorate sputum. Doctor ordered sputum culture and AFB via suction method.
Good morning, Mrs. Wilson. I'm your nurse today. Dr. Lee has ordered a sputum test to check for infection. Since you're having trouble coughing it up, I'll be helping you get the sample using a suction catheter. I'll explain everything step by step.
Okay, I've tried, but nothing comes out.
That's totally okay. You'll be awake the whole time and we'll go slowly. You might feel a little discomfort when I insert the catheter into your nose, but I'll talk you through it. I'll first set up the equipment. This clear container is the specimen trap. I'll connect the catheter to this trap and then attach it to the suction machine. Once everything's connected, I'll insert the catheter through your nose and guide it gently toward your airway.
Okay, I'm ready.
I'm turning the suction on now. I'll first flush a little sterile saline through the catheter to prepare it. Now I'm going to insert the tube.
Slowly insert catheter through nostril into pharynx. Once a cough reflex is triggered, begin suction. Gently move catheter in and out to gather mucus. Flush saline again to clear mucus into the specimen trap. Remove catheter and disconnect trap seal container.
You did really well, Mrs. Wilson. The sample looks good thick and from deep inside your lungs. I'll send it to the lab now.
That wasn't as bad as I thought. Thank you for being gentle.
You were amazing. Thanks for trusting me. Let me know if you feel any tightness or shortness of breath later. I'll check in on you again soon.
SBAR report to doctor.
Hi, Dr. Patel. This is Nurse Kim from the respiratory unit calling about Mrs. Wilson in room 205. We collected a sputum sample from her via suction at 6:55 this morning. She's a 74-year-old with a COPD exacerbation and wasn't able to expectorate on her own. You had ordered a sputum culture and an AFB test. She tolerated the suctioning well. The sample was thick and yellow with no signs of blood. The procedure went smoothly without any complications. We'll keep an eye on her for any respiratory discomfort after suctioning, and I'll update you when the lab results come back.
Scenario 3, respiratory virus PCR using specimen trap, VTM, COVID-19 included.
Good morning, Mr. Choi. I'm your nurse today. Dr. Nguyen has ordered a PCR test for respiratory viruses, including COVID-19, since you've been having fever and trouble breathing. Since you can't bring up phlegm, we'll collect it using a suction catheter and a special viral transport medium.
Is this like the COVID swab I had before?
It's a bit different. This test collects mucus from deep in your lungs using suction. I'll use a sterile saline flush and a trap with VTM, a special liquid that keeps viruses stable until they reach the lab. I'll insert a thin tube through your nose into your airway. You might feel like coughing. That's expected. I'll flush a little saline first to help loosen the mucus. Then we'll suction and collect the sample into this container.
Okay, let's do it.
I'm starting suction now. Saline going in, catheter going in. Gently, deep breath. Now I'm collecting the sample.
Insert catheter through nostril to pharynx. Instill saline to induce cough and loosen secretions. Activate suction and collect mucus into trap pre-filled with VTM. Once enough sample collected, remove catheter. Seal trap and place in biohazard transport bag.
That was different from the nose swab, but it wasn't too bad. Thanks for letting me know what to expect.
You did great. We needed a deep sample and we got a good one. I'll call you when the results are in. If you have any tightness or sore throat later, let me know.
SBAR report to doctor.
Hi, Dr. Lee. This is Nurse Kim from the medical ward calling about Mr. Choi in room 218. We collected a respiratory PCR sample via suction at 11:08 a.m. He's a 58-year-old male presenting with fever and shortness of breath. You had ordered COVID-19 testing along with the full multiplex respiratory virus panel. We used a VTM trap to collect mucus from his lower airway. He tolerated the suctioning well, and there were no complications during the procedure. We'll continue to monitor him for any post-procedure coughing or discomfort, and I'll let you know once the PCR results are in.
Charting example.
1108. Respiratory virus PCR specimen collected via suction using VTM specimen trap. Sterile catheter inserted via nasal passage. 8 ml normal saline instilled. Adequate mucus obtained and trapped in viral transport medium. No complications noted. Specimen labeled, sealed, and sent to lab in biohazard bag.
Scenario 4, preventing sputum sample errors, saliva contamination, and inadequate volume.
Outpatient clinic, 8:45 a.m. A 62-year-old male patient submitted a sputum sample for culture and AFB earlier that morning. The lab has rejected the sample due to contamination with saliva and insufficient volume. The nurse must re-educate the patient and collect a new specimen.
Hello again, Mr. Lee. I just received a message from the lab. Unfortunately, your earlier sputum sample was rejected. They found mostly saliva, not real mucus, and there wasn't enough volume to run all the tests.
Really? I thought I did it right.
Don't worry. It's a very common mistake. A proper sputum sample needs to come from deep in your lungs, not just your mouth. I'll explain it again and guide you step by step. We'll collect another sample now. Let's try again. This time, start by rinsing your mouth with water to get rid of any food or saliva. Then take 3 deep breaths, and on the 4th one, cough hard from your chest, not your throat.
Okay, that makes more sense now.
You should feel the mucus coming from deep down. It might help to lean forward slightly. Once you have a good amount, spit it directly into the container without touching the inside.
Patient attempts and successfully provides a thick sputum sample.
That looks perfect. Thick, yellow, and enough volume. This will work much better. I'll send it to the lab immediately.
Thanks for taking the time to show me again. I didn't realize saliva could cause the test to fail.
You're not alone, this happens all the time. What you gave now is exactly what we needed. I'll keep you updated when the results come back.
SBAR report to doctor.
Hi, Dr. Kim. This is Nurse Park from the Med-Surg unit calling about Mr. Lee in room 310. His initial sputum sample was rejected by the lab due to saliva contamination and insufficient volume. He's a 62-year-old male with a suspected pulmonary infection. You had ordered a sputum culture and AFB test. We re-educated him on the correct deep cough technique and were able to collect a second sample successfully. This one looks adequate. We've sent the new specimen to the lab for processing. No further issues at this time, but I'll keep you updated if anything changes.
Scenario 5, proper labeling and transport of sputum specimens.
Internal Medicine Ward, 9:15 a.m. A 67-year-old male patient has just completed sputum self-expectoration for culture and AFB tests. The nurse is responsible for labeling, sealing, and sending the specimen to the lab within proper time and handling guidelines.
Good morning, Mr. Han. I see you've just finished collecting your sputum sample. I'll take that from you and make sure it gets safely to the lab. Before I do, I'll walk through the steps to make sure everything is accurate and safe.
Sure, I hope that was enough.
Let's check. Yes, it looks good. Thick and from deep inside. Now, I'll make sure the label and transport process are correct so the test result is valid. I've labeled your specimen while still in the room with you, and the label matches your information exactly.
Securely tighten the lid of the specimen cup. Place the cup in a biohazard transport bag. Fill out the lab requisition slip and match it with the specimen. Check that test requires room temperature or refrigeration. In this case, room temperature.
Notify porter for immediate delivery or deliver to lab directly.
Mr. Han, I've sealed your sample and will now send it to the lab. We always make sure it gets there within 30 minutes for tests like AFB or cultures.
I didn't know you had to label it right here. That seems important.
Yes, labeling it bedside avoids mix-ups and makes sure your results are accurate. Thanks for your cooperation today.
Scenario 6, pretest patient education for sputum collection.
Outpatient Respiratory Clinic, 7:10 a.m. A 64-year-old male patient has been scheduled for a sputum culture and AFB test. He is about to collect the sample on his own, and the nurse is providing step-by-step education.
Good morning, Mr. Park. I see you're scheduled to give a sputum sample today for culture and TB testing. Before we start, I'd like to explain exactly how to collect it so the result is accurate.
Sure. I've done one before, but I'm not sure I did it right.
That's okay. Many people mix up saliva and true sputum. The lab needs mucus from deep inside your lungs, not just spit from your mouth. The best time to collect sputum is early in the morning, right after you wake up. Do not brush your teeth or eat before the collection. Start by rinsing your mouth with plain water to remove saliva and food particles. Then take 3 deep breaths and on the 4th breath, cough deeply from your chest. You may need to do this a few times to bring up the mucus. Spit the thick phlegm directly into the specimen cup. Don't open the cup until you're ready. Avoid touching the inside. If the sample is clear, bubbly, or mostly saliva, the lab may reject it.
Got it. Should I cough hard or just let it come naturally?
Cough from your chest, not your throat. Try to bend forward slightly. That can help move mucus up from your lungs.
Okay, I'll give it a try now.
Take your time. If it doesn't work right away, we can try a few techniques to help.
SBAR documentation internal.
Provided pretest education to Mr. Park prior to sputum sample collection. 64-year-old male referred for sputum culture and AFB testing. Patient was able to explain the difference between sputum and saliva and correctly demonstrated the deep breathing and coughing technique after instruction. Proceed with supervised sputum collection. Monitor the quality of the sample and reinforce technique if the specimen appears inadequate.
Thanks. I didn't realize how different real sputum is from saliva. I'll try my best to get a good sample.
You're doing great. Let me know if you feel dizzy or need help. I'm here to guide you through it.
Scenario 7, sputum collection via suction in an uncooperative or critically ill patient.
Medical ICU, 2 p.m. A 79-year-old female patient with pneumonia is on oxygen therapy, drowsy, and unable to cough up sputum. The physician has ordered a sputum culture and AFB test via suction. The patient is unable to follow instructions, so the nurse must perform the suction independently.
Hi, Mrs. Kim. I'm going to collect a sputum sample using suction today. You're a little drowsy, so I'll take care of everything. It might feel uncomfortable, but I'll be gentle and talk you through it.
Patient Mrs. Kim, moaning, semi-conscious, nurse to herself.
Patient is responsive to pain but not following commands. On 2 liters of oxygen via nasal prongs. Respiratory rate 22. Oxygen saturation 95%. Temperature 37.4 degrees Celsius. Heart rate 90. Blood pressure 132/76.
Position patient in semi-Fowlers or lateral if needed. Perform hand hygiene and wear full PPE.
Vitals are stable. I'll begin suctioning now. Please observe for any desaturation or distress.
Connect catheter to suction and trap. Pre-flush with sterile saline. Insert catheter gently through the nostril to posterior pharynx. Begin suctioning when resistance or coughing reflex is sensed. Move catheter gently in and out to collect lower airway mucus. Flush again to clear sample into trap. Remove catheter, seal specimen, clean up.
You did well. The sample is collected and I'll monitor you closely now. You're okay, Mrs. Kim. I'm staying right here. Just rest while we keep supporting your breathing.
2. Blood collection. Scenario 1, verifying patient identity and performing basic blood draw procedure.
Medical surgical ward, 9:30 a.m. A 68-year-old male patient with hypertension and type 2 diabetes is scheduled for routine blood work, including CBC, electrolytes, and HbA1c.
Good morning, Mr. Sanders. I'm your nurse for today. I'm here to take some blood for your scheduled tests. Before we start, I need to confirm your identity. Can you please tell me your full name and date of birth?
Yeah, it's George Sanders. March 12th, 1956.
Thank you, Mr. Sanders. That matches your armband and the lab label. Let me check your chart one more time. All right, we'll be drawing blood for your complete blood count, electrolytes panel, and hemoglobin A1c today. I'll be using 2 tubes, this yellow top SST tube for the electrolytes, and this purple top EDTA tube for the CBC and HbA1c.
Will it hurt much?
You'll feel a quick pinch, but I'll be as gentle as I can. I'll also walk you through each step. Are you okay with me starting now?
Sure, go ahead.
Nurse explains to Mr. Sanders that I will place a tourniquet on his upper arm but will not leave it on for more than 1 minute to avoid hemoconcentration.
You'll feel the band tightening a little. Let me know if it becomes uncomfortable.
It's all right. I can handle it.
I clean the antecubital area with an alcohol swab in a circular motion for 30 seconds and allow it to air dry. I insert the needle with the bevel up and begin the draw. I fill the SST tube first 4 to 5 milliliters, followed by the EDTA tube 3 milliliters, following the correct order to prevent contamination. After filling each tube, I gently invert them.
SSD 5 times, EDTA 8 to 10 times.
Now I'm removing the needle. I'll ask you to press this cotton ball on the site while I apply the bandage.
Okay, that wasn't so bad.
That's great. You did well. Let me take your vital signs quickly before I send these to the lab.
Thanks for explaining everything. I always get nervous, but you made it easy today.
You're very welcome. Let me know if you feel dizzy or notice any bruising later. I'll be back to check on you soon.
Scenario 2, proper blood draw order according to tube type.
Internal Medicine Ward, 7:15 a.m. A 72-year-old female patient is scheduled for multiple blood tests. The orders include blood culture, PT, APTT, liver function tests, CBC, and TB antigen test.
Good morning, Ms. Harlow. I'm your nurse today. The doctor has ordered a few blood tests for you this morning. These include blood culture, coagulation studies, liver and kidney function tests, complete blood count, and a TB antigen test.
That sounds like a lot. Is it all done in one go?
Yes, I'll collect them all in one sitting using different tubes. It might seem like a lot of tubes, but I'll explain each one as we go. The order in which I fill the tubes is very important to prevent contamination or inaccurate results. I'll walk you through the whole process.
Okay, I trust you. Just tell me if I need to do anything.
Thank you, Ms. Harlow. Just relax your arm and keep still during the procedure. I'll handle the rest.
Nurse washes hands and gathers all supplies. Alcohol swabs, tourniquet, butterfly needle, gloves, cotton balls, bandages, and the following tubes. Blood culture bottles, plain tube, citrate tube, SSD tube, EDTA tube, TB antigen tubes. All tubes are pre-labeled at the bedside with the patient's name, date of birth, and registration number. Applies tourniquet for less than 1 minute, palpates the vein, disinfects the site with an alcohol swab in a circular motion for 30 seconds, and allows it to dry.
I'm starting with the blood culture bottles because they must be sterile to avoid false positives. I fill the anaerobic bottle first, then the aerobic bottle. Next is the plain red top tube, used for drug level or cryoglobulin testing. Then I collect the light blue citrate tube. This is for PT and APTT, and I must fill it precisely to the fill line 2.7 milliliters to ensure accurate results. After that comes the yellow top SST tube for liver, kidney, and thyroid function tests. Next is the purple top EDTA tube for CBC and HbA1c. EDTA contains potassium, so it must always be last to avoid contaminating other tubes. Finally, I collect 1 milliliter each into the 4 TB antigen tubes. Each tube must be filled to the line and inverted 10 times to mix.
You seem to know exactly what you're doing.
Thank you. It's important to follow this exact sequence to ensure the tests are reliable. We often say, order of draw protects the data.
You made that look so smooth. I've had blood draws where they had to try 3 times.
I'm glad it went well today. Let me know if you feel dizzy or if the site gets sore later. I'll check back with you in a little while.
Scenario 3, routine blood collection using SSD, EDTA, and plain tubes.
General Ward, 6:50 a.m. A 58-year-old male patient is scheduled for early morning routine blood work. CBC, liver function test, and therapeutic drug level digoxin.
Good morning, Mr. Rivera. I'm your nurse today. The doctor has ordered some blood work for this morning, just the usual labs. We'll be checking your complete blood count, liver function, and digoxin level.
Morning. Yeah, they told me yesterday. I've been taking digoxin every day. Do I need to stop anything before the blood draw?
That's a good question. Since we're checking your digoxin level, I need to draw your blood just before your morning dose. So please don't take your medication until after the sample is collected.
Got it. Haven't taken it yet.
Perfect. I'll explain everything as we go, and it'll just be a quick draw. I'll be using 3 tubes. 1 yellow top SST tube for the liver function test, 1 purple top EDTA tube for your CBC, and 1 red top plain tube for the digoxin level. Let's begin. You'll feel a little pinch. Try to relax your arm.
Okay, I'll try.
I insert the needle and start with the plain red top tube first for the drug level. Next, I fill the yellow top SST tube for liver function tests. Finally, I fill the purple top EDTA tube for CBC. I gently invert each tube to mix. Red plain, no mixing needed. SST 5 times. EDTA 8 to 10 times. All done. I'm removing the needle now. Please press on this spot for a moment while I apply the bandage.
That wasn't bad at all.
You did great. I'll take these to the lab right away. Don't forget, you can take your digoxin now.
Thanks for being careful with the digoxin timing. Last time, I think they took it after I took the pill.
You're welcome. Timing is everything with drug levels. Let me know if you feel lightheaded or see any bruising. I'll check on you again in a bit.
Scenario 4, blood culture collection with strict aseptic technique.
Medical ward, 8:40 p.m. A 65-year-old male patient recently admitted with a fever of 39.1 and chills. Doctor suspects sepsis. Blood cultures are ordered urgently along with CBC and CRP.
Good evening, Mr. Benson. I'm your nurse tonight. The doctor has ordered some urgent blood tests because of your high fever. We need to check if there's a bloodstream infection, so I'll be collecting blood cultures, as well as routine labs like CBC and CRP.
Yeah, I've been shivering all day. I feel terrible.
I'm sorry you're feeling this way. We'll try to find out quickly what's causing it. I'll need to draw blood from 2 different sites, and I have to be very careful to keep everything sterile.
That sounds serious. Okay, do what you need to.
Thank you. I'll explain everything as we go. I label all tubes at the bedside with the patient's full name, DOB, and ID number. I apply the tourniquet for less than 1 minute and palpate 2 different veins, left and right forearm.
Site 1. First blood culture set.
I clean the site using chlorhexidine in a back and forth motion for 30 seconds. Allow it to air dry completely. I do not touch the site again. I open the blood culture bottles and wipe the rubber stoppers with alcohol swabs. Using a butterfly needle, I draw 10 ml total blood, 5 ml per bottle. I inject blood into the anaerobic bottle first, then the aerobic bottle. I gently invert each bottle to mix.
Site 2. Second blood culture set.
I repeat the exact same procedure on the opposite arm, maintaining sterile technique.
That's a lot of blood.
It may seem like it, but it's essential to collect from 2 sites to avoid contamination and get a clear result. Now I'll collect the routine labs.
Thanks for being so careful. I feel really weak, but I trust you guys know what you're doing.
We're keeping a close eye on you, Mr. Benson. Let me know right away if you feel worse or have any new symptoms.
Scenario 5, blood collection via central venous catheter. ICU, 7 a.m. A 73-year-old female patient with a triple lumen central venous catheter is scheduled for blood tests including CBC, PT, APTT, and a serum drug level. She is currently receiving IV fluids through 1 lumen.
Good morning, Mrs. Park. I'm your nurse today. We're going to draw some blood for your morning labs, your CBC, coagulation tests, and drug level monitoring. Since you have a central line, we'll be using that instead of poking your vein.
That sounds better. My arms are full of bruises already.
I understand. I'll be drawing the blood from your central venous catheter, and I need to follow a strict sterile technique. You're currently getting IV fluids, so I'll use a different lumen for the draw. I verify the patient and the orders and then identify the unused lumen on the triple lumen catheter. I pause the IV infusion temporarily if on shared lumen. Switch lumen if possible. I scrub the port hub with chlorhexidine for 15 seconds and let it dry completely. I unclamp the lumen and attach the first syringe. Withdraw and discard 5 ml of blood called waste or discard sample to remove any residual medication or fluids. I then attach a new syringe and draw the required amount of blood into appropriate tubes. I gently invert the tubes and confirm sample volume. I flush the lumen with 10 milliliter of sterile saline, then reclamp the catheter. All finished, Mrs. Park. That went smoothly. I used a different port from your IV line and everything stayed sterile. I'll take these to the lab right away.
Thanks. That's much easier than more pokes.
I'm glad to hear that. Let me know if you feel dizzy or notice any swelling around the site.
Thank you for being so careful. I was dreading another needle.
You're welcome. Central lines can really help us avoid repeated needle sticks. I'll check the site again in a little while to make sure everything's okay.
Scenario 6, preventing hemolysis and clotting during blood draw.
General Ward, 2:30 p.m. A 61-year-old female patient is scheduled for routine CBC and electrolyte testing. A newly hired nurse is preparing to perform the venipuncture.
Hi, let's go over this blood draw together. The patient needs a CBC and electrolytes, so you'll be using an EDTA and an SST tube. Let's focus on avoiding common mistakes like hemolysis and clotting, okay?
Got it. I've heard that happens if you draw too fast or mix poorly.
Exactly. I'll guide you through it. Wash your hands and check the patient's name, date of birth, and wristband. Make sure all tubes are pre-labeled at the bedside. Now, gather your supplies. Butterfly needle, alcohol swab, gloves, tourniquet, cotton, SST and EDTA tubes, gauze, and bandage.
Applying the tourniquet now.
Good. Remember, don't leave the tourniquet on for more than 1 minute. Longer time can lead to hemoconcentration or hemolysis.
Okay, prepping the site now with alcohol. 30 seconds, circular motion, letting it dry.
Perfect. Let's avoid common causes of hemolysis. Pulling the plunger too fast. Using too small a needle. Not letting alcohol dry. Hitting the vein wall too hard. Forcing blood into tubes.
Inserting now. Blood's flowing. I'll fill the SST first, then EDTA.
Great order. Now remember, don't push the blood into the tubes manually. Let vacuum do the work. And once filled, invert gently.
Okay, removed the needle, applying pressure with gauze.
Well done. What could cause clotting?
Maybe not mixing the EDTA tube properly?
Correct. If it clots, CBC will be invalid and we'll have to repeat the draw. Always mix right away.
You were very gentle. That was a nice change from the last time.
Thank you for saying that. I'm learning a lot under supervision, and I really appreciate your patience.
You're doing great. We always aim to protect the quality of the sample and your comfort.
Scenario 7, blood collection for TB-specific antigen using dedicated 4-tube set.
Outpatient Department Infectious Disease Unit, 10:45 a.m. A 42-year-old male patient has been referred for TB screening using the TB-specific antigen test. The nurse is preparing the 4-tube quantiferon-like test set.
Hello, Mr. Kim. I'm the nurse assisting you today. Your doctor has ordered a TB antigen blood test. It requires a special 4-tube set, and I'll walk you through the process as we go.
Sure. Is this different from regular blood tests?
Yes, it's a bit more specific. These tubes are sensitive to how much blood is drawn and how well they're mixed, so I'll be especially careful. I'll apply the tourniquet now and clean your arm. Please hold still. Each tube must be filled to the exact black line. 1 milliliter. If it's underfilled or overfilled, the lab might reject it. After each tube is filled, inverts it exactly 10 times to mix with the antigens on the wall. Completes the draw, applies pressure and bandage. All done, Mr. Kim. These samples are time-sensitive, so I'll send them to the lab immediately.
Thanks. So this checks if I've been exposed to TB?
Exactly. It looks for how your immune system responds to TB proteins. Results usually take a few days.
Thanks for explaining everything. I thought it was just a regular test.
A lot of people do. This one's a little more sensitive, so we take extra steps to make sure it's accurate. I'll let you know when the results come back.
Scenario 8, Drug Level Blood Draw Timing, Pre-Dose Protocol.
Cardiology ward, 6:45 a.m. A 70-year-old male patient is on daily digoxin. A drug level test is scheduled for this morning. The nurse is informed the patient is due to take the medication at 7 a.m.
Good morning, Mr. Thompson. I'm your nurse today. I see you're scheduled for your digoxin level test this morning. Have you taken your medication yet?
Not yet. I usually take it around 7 a.m. with my other pills.
Perfect. Please wait just a few more minutes. I'll draw your blood before you take your morning dose. That way, the result will reflect the trough level, which is what the doctor needs. Washes hands, prepares SST and plain tubes, verifies patient ID and test order. Confirms with medication chart that digoxin is scheduled at 7 a.m. Documents intended time of medication and planned draw time. Applies tourniquet, cleans site with alcohol, inserts needle, collects. Plain red top tube for digoxin level.
Removes needle, applies pressure, and labels tubes with time of draw 6:50 a.m.
Thanks for waiting. You can now take your digoxin as usual.
All right, so this checks how much of the drug is left in my system.
Exactly. It tells us how well your body is processing it. Timing is everything with this kind of test.
Thanks for explaining. Makes sense now why timing matters. I thought blood is blood, you know?
Many people think that. But with drugs like digoxin, timing affects everything. You did great. I'll check in later once we get the results.
Scenario 9, Verifying External Lab Test and Sample Storage.
Internal medicine ward, 11:15 a.m. A 66-year-old female inpatient is scheduled for cryoglobulin and ACTH basal tests. These are known to be external referral tests. The nurse must confirm test conditions with the lab before drawing blood.
Good morning, Mrs. Lewis. I'm going to draw some blood for a couple of special tests your doctor ordered. Cryoglobulin and ACTH basal.
Okay. Is that different from the usual ones?
Yes, these are referral tests, which means the samples are sent out to an external lab. That's why I need to confirm a few things before we start. The storage conditions and timing are very strict.
Nurse prepares plain and ETA tubes and labels them carefully. Informs the team to stand by for urgent delivery to the lab post-draw.
I'll draw the blood now. We'll need to send these to an outside lab, so I'll move quickly after the draw to make sure they stay valid.
No problem. Thanks for explaining. I didn't know some tests had to be so fast. That's interesting.
Yes, certain substances can degrade quickly or react to temperature, so we follow strict handling rules. I'll check the results once the lab confirms receipt.
Scenario 10, Aseptic Blood Culture Re-education After Contaminated Specimen.
Medical ward, 1:20 p.m. A blood culture sample collected earlier in the day from a 59-year-old male patient was returned by the lab with a note, possible contamination due to non-aseptic collection. The nurse is now preparing for a redraw and reviewing proper technique with a colleague.
Hey, I saw the lab note. It looks like Mr. Cho's blood culture came back with a contamination flag. Do you remember what happened during the first draw?
Yeah, I think I might have touched the site again after cleaning. I was trying to reposition the patient's arm.
Thanks for being honest. That could definitely cause issues. Let's go over the correct aseptic technique together before you redraw. Wash hands. Prepare 2 blood culture bottles, aerobic and anaerobic. Use chlorhexidine swab for 30 seconds back and forth motion, then air dry completely. Do not touch the site again after prepping, even if the vein moves. Scrub the bottle tops with alcohol. Use a 21-gauge butterfly needle and draw 10 milliliter. Fill anaerobic bottle first, then aerobic bottle. Gently invert each bottle.
What if I need to adjust the vein?
If you must, you need to re-disinfect the area completely. Also, always draw from a fresh site. Never reuse the same one that may have been contaminated. Redraw execution. Returns to the patient, explains the situation. Obtains consent for redraw due to possible contamination. Applies new tourniquet. Selects different arm or site. Proceeds with proper aseptic technique as reviewed. Labels bottles clearly and notes redraw on the lab slip.
SBAR Report Internal Clinical Note.
Hi, Dr. Han. This is Nurse Kim from the medical ward calling about Mr. Cho in room 216. We redrew his blood cultures due to contamination in the initial sample. He's a 59-year-old male with a fever. The original sample was collected at 7:30 a.m. It looks like the initial draw may have been compromised. There was likely contact with the site after skin disinfection. We've recollected the sample and sent it to the lab. I'd also recommend reinforcing aseptic technique during our next ward training session. We'll await the new results.
So you're taking the blood again? Was there something wrong?
Yes, the lab noticed a possible contamination in the first one. Just to be safe, we're redoing it carefully. Thank you for understanding.
3. Urine and stool collection. Scenario 1. Urinalysis and chemistry urine test.
Medical ward, 8:45 a.m. A 51-year-old female patient is scheduled for a urinalysis and urine chemistry test. The nurse is tasked with explaining and supervising proper midstream clean catch collection.
Good morning, Ms. Lee. I'm your nurse today. Dr. Han has ordered a urinalysis and a urine chemistry test for you. I'm going to explain how to collect your urine properly, and I'll help you get everything ready.
Okay, I've done urine tests before, but sometimes I'm not sure if I'm doing it right.
That's very common. For this test, the lab needs a clean midstream urine sample. That means we need to avoid any contamination from skin or vaginal discharge. First, are you currently menstruating? If yes, we may postpone the test or note it for the lab. Here is a disposable cleansing wipe. Please wipe yourself front to back once before urinating. Then begin urinating into the toilet, pause briefly, and catch the midstream urine in this sterile container. Fill the container to about half full, around 30 to 50 milliliters. Do not touch the inside of the lid or cup. Afterward, screw the cap on tightly and place the cup into this biohazard bag.
So I shouldn't collect the first part of the stream?
Correct. The first part flushes out bacteria or debris around the urethra. That's why we use the midstream portion.
Okay, I'll do it now. Thanks for explaining it clearly. I always wondered if I was doing it right.
You did a great job. Clean samples make a big difference in getting accurate results. Let me know if you feel dizzy again or need anything else.
Scenario 2. Sterile urine collection for culture and MIC.
Internal medicine ward, 10:30 a.m. A 63-year-old female patient with fever and dysuria is suspected of having a urinary tract infection. Doctor has ordered a sterile urine culture and MIC minimum inhibitory concentration test. The nurse must explain and assist the patient with the clean catch method and ensure sterile handling.
Good morning, Ms. Park. I'm your nurse today. Dr. Kim has ordered a urine culture and sensitivity test to see if there's a urinary tract infection and which antibiotic might work best. For that, we need to collect a sterile midstream urine sample.
Is that different from a regular urine test?
Yes, it's more sensitive. We need to be extra careful not to contaminate the sample. That's why we'll use a sterile cup and give you clear instructions. Have you done this kind of test before?
Not really. Can you walk me through it?
First, are you on your period? If yes, we may need to delay the test. Use this sterile wipe to clean your genital area front to back 3 times, once on each side and once down the middle. Then begin to urinate into the toilet. Stop briefly and collect the midstream in this sterile container without touching the inside. Try to fill about 30-50 milliliters. When you're done, seal the cup tightly and place it in the biohazard bag.
What if I accidentally touch the inside or can't aim well?
Let me know if that happens. In some cases, if the sample is contaminated, we may need to use a Nelaton catheter to collect it directly from your bladder.
I didn't realize there were different ways to do urine tests. Thanks for helping me understand.
You're welcome. This helps ensure we find the right treatment. If you feel more pain or fever rises, let me know right away.
Scenario 3, 24-hour urine collection for kidney function evaluation.
Nephrology ward, 9:15 a.m. A 57-year-old male patient is scheduled to begin a 24-hour urine collection to evaluate kidney function and proteinuria. The nurse must explain the full procedure, provide the appropriate container, and document timing accurately.
Good morning, Mr. Han. I'm your nurse today. Dr. Lee has ordered a 24-hour urine test to evaluate how your kidneys are functioning. This test helps measure substances like protein and creatinine that are excreted throughout the day.
I've never done that before. Do I just pee into a big container all day?
You're partly right. Let me walk you through the steps so we can make sure the collection is done properly. It's very important that no sample is missed.
Patient education, 24-hour collection instructions.
First, we will discard the first urine you passed today. That starts the clock. After that, every drop of urine for the next 24 hours must be collected in this container. Please do not urinate directly into the container. Use a clean urinal or collection hat, then transfer it carefully. Keep the container in a cool place or on ice or refrigerated if at home. At 9:15 a.m. tomorrow, your last urine sample should be added to this container. That ends the collection. Please avoid excessive physical activity or high-protein meals during the test.
What happens if I forget to collect one sample?
Then unfortunately, we would need to start over. Missing even one sample can make the results inaccurate.
Understood. I'll make sure to keep track. Thanks for the detailed explanation. I didn't realize missing one time could affect the whole result.
Absolutely. You're doing great by asking questions. If you have any doubts or need help transferring the sample, let us know anytime.
Scenario 4, urine collection precautions for female patients.
Outpatient clinic, 2 p.m. A 38-year-old female patient arrives for a routine urinalysis. The nurse must provide clear instructions for proper sample collection, with emphasis on contamination prevention due to menstruation or vaginal discharge.
Hello, Ms. Jung. I'll be helping you today with your urine test. Dr. Min has requested a routine urinalysis to check your kidney function and rule out any infection.
Sure. I just go and pee in the cup, right?
Almost. Since you're a female patient, I want to explain a few important steps to make sure we get a clean and accurate sample. Especially because vaginal discharge or menstrual blood can affect the results.
Patient education, female-specific precautions.
First, are you currently on your period? If yes, we can either reschedule or notify the lab so they can interpret results properly. Next, before you urinate, please use this disposable cleansing wipe to clean the area front to back. First one side, then the other side, and then down the middle. Begin to urinate into the toilet, then pause briefly and collect the midstream urine in this sterile cup. Try to collect about 30 to 50 milliliters, about halfway full. Be careful not to touch the inside of the lid or cup. Seal the container and place it into this biohazard bag.
What if I accidentally touch the inside? Or what if I'm spotting a little?
If that happens, let me know and we can collect the sample again. If you're spotting, we'll make a note for the lab and try to minimize contamination with careful cleaning.
Thanks for explaining it. I didn't realize that could make a difference.
You're welcome. It's a small step, but it makes the results much more reliable. Just let us know if you have any discomfort or concerns later.
Scenario 5, Stool Sample Collection and Patient Education.
Gastroenterology ward, 8:40 a.m. A 45-year-old female patient is ordered to submit a stool sample for occult blood and parasite testing. The nurse must explain the purpose of the test, how to collect the sample hygienically, and what to avoid.
Good morning, Ms. Lee. Dr. Jang has ordered a stool test for you to check for hidden blood and possible parasites in your digestive system. I'll walk you through how to collect the sample properly.
I've never done that before. Is it complicated?
It's not difficult, but there are a few important steps. Following them will help make sure your results are accurate.
Patient Education, How to Collect a Stool Sample.
First, please do not urinate into the sample container or the toilet at the same time. Try to urinate first if needed. Use this clean paper or stool collection hat in the toilet to catch the stool. Use the spoon attached to the lid to scoop a small amount from different parts of the stool about the size of a walnut in total. Place it into this sterile container and seal the lid tightly. Try not to mix stool with urine or toilet water. Return the container to me as soon as possible. If at home, keep it cool and bring it to the lab within 2 hours. Please avoid eating red meat, beets, or taking iron supplements for 2 days before the test if possible, as these can affect the occult blood result.
What if I'm on my period?
Good question. If you're menstruating, it's better to delay the test to avoid contamination. Let me know if that applies to you.
Thanks. I was a bit embarrassed to ask, but the step-by-step explanation really helped.
That's completely normal. It's my job to support you. You did great, and your cooperation helps us give the best care.
Scenario 6, Urine Sample Labeling and Transport to the Laboratory.
Internal Medicine ward, 10:30 a.m. A 62-year-old male patient has just submitted a urine sample. The nurse is responsible for verifying patient information, labeling the sample correctly, sealing it safely, and ensuring prompt transport to the lab under proper conditions.
Hi, Mr. Park. Thanks for submitting your urine sample. I'll now label it and get it ready to be sent to the lab. Proper labeling and timely transport are key to making sure your test results are accurate.
Does it matter how fast you send it?
Yes, ideally the sample should reach the lab within 30 minutes to 1 hour to avoid degradation. Some tests, like bacterial cultures, are very sensitive to delays.
Nursing Procedure, Labeling, and Transport.
Perform hand hygiene. Put on gloves. Verify patient identity using 2 identifiers, full name and date of birth. Match with test requisition form. Label the container with patient's full name, date of birth. Hospital registration number, date and time of collection. Test type, urinalysis, culture. Double check for legibility and completeness. Place labeled specimen into a biohazard transport bag. Seal the bag properly. Store in designated refrigerated box if delay expected. Fill out transport log sheet if required. Send specimen to lab via designated collection time or courier system.
Thanks for explaining. I always thought once I handed over the sample, it was just done.
It's a bit more involved behind the scenes. Proper handling ensures the results are reliable. Let us know if you need anything else today.
Scenario 7, Preventing Specimen Errors and Managing Recollection, Urine, Stool Samples.
Laboratory reception desk, 1:15 p.m. A nurse receives a call from the lab stating that a urine sample submitted earlier from a 52-year-old male patient is invalid due to contamination with toilet water. The nurse must inform the patient, re-educate proper collection technique, and arrange for recollection.
Hello, Mr. CO. I'm your nurse this afternoon. I wanted to let you know that the lab has reviewed your earlier urine sample. Unfortunately, the test couldn't be processed because the sample was contaminated, likely with toilet water.
Oh, I didn't realize that. I thought I did it right.
It happens sometimes. No worries at all. We'll just collect a new sample, and I'll guide you through the steps again to make sure it goes smoothly this time.
Patient education, avoiding common collection mistakes.
Please avoid urinating directly into the toilet bowl during collection. Use the provided collection hat or clean paper to catch the urine first. Only collect the midstream portion. Start urinating into the toilet, then collect after a few seconds. Don't touch the inside of the cup or lid. If you have a bowel movement, avoid stool contamination by separating the two. Let me know if you're currently menstruating or have hemorrhoids, as we may need to adjust the collection plan.
Got it. Sorry about the first time.
No need to apologize. Your health and safety come first, and it's our job to help guide you.
Scenario 8, Stool Swab Collection Using Transport Media.
Infectious disease outpatient clinic, 9:10 a.m. A 35-year-old male patient has returned from overseas travel and is experiencing persistent diarrhea. The doctor has ordered a stool culture using a transport swab kiddo check for enteric pathogens. The nurse is responsible for explaining the swab collection process, ensuring the correct use of the transport medium, and preparing the sample for timely lab transfer.
Good morning, Mr. Han. I'm your nurse today. Dr. Park has requested a stool culture test using a swab, which will help identify any bacteria or parasites that might be causing your diarrhea after your recent trip.
I see. I've only had regular stool tests before. How is this one different?
This one uses a swab to collect a small amount of stool, either from the toilet tissue or directly from the rectal area, and places it into a tube filled with transport media. This keeps any pathogens alive until the lab can process it.
Patient education, how to collect a stool swab sample.
You can collect the sample yourself in the restroom, or I can assist if needed. Please defecate into the provided clean collection container or onto clean tissue. Use this cotton swab to collect a small amount, about the size of a pea, from the surface of the stool, especially any bloody or mucus areas. Insert the swab tip into this transport tube and snap the stick at the marked point so the lid can close properly. Make sure the swab tip is completely submerged in the transport media. Screw the lid tightly and place the tube into this biohazard bag. Hand it to me as soon as you're done so I can send it to the lab immediately.
If there's very little stool, is it still okay?
Yes, even a small amount is enough. It's more important that the swab is taken from the correct area.
It felt a little awkward, but the instructions helped a lot. Thanks for guiding me through it.
You did great. It's not the most comfortable process, but you followed it perfectly. The lab will contact us once they've completed the testing.
Scenario 9, VRE Stool Sample Collection Using Selective Media.
Isolation room, medical surgical ward, 4:20 p.m. A 78-year-old female patient who has been recently transferred from a long-term care facility is placed under contact precautions due to potential exposure to multi-drug-resistant organisms. The doctor has ordered a VRE screening test using selective stool media. The nurse must collect a rectal swab, ensure proper infection control, and complete documentation and reporting.
Good afternoon, Mrs. Lim. I'm your nurse today. As part of our infection prevention protocol, Dr. Kim has ordered a screening test for VRE that stands for vancomycin-resistant enterococci. It's a type of bacteria that can live in the intestines and doesn't always cause symptoms but can spread in healthcare settings.
Am I infected?
Not necessarily. This is a routine screening since you were recently transferred from another facility. It helps us ensure we're keeping both you and other patients safe. The test involves taking a small sample using a swab from your rectal area. It only takes a moment.
Swab collection procedure.
Mrs. Lim, I'm going to insert a small sterile swab about 2.5 centimeters 1 inch into your rectum and rotate it gently for a few seconds. You might feel slight pressure, but it shouldn't be painful. Gently insert swab into rectum about 2.5 centimeter 1 inch. Rotate for 5-10 seconds. Withdraw swab and immediately place it into the VRE selective media tube. Break shaft if needed, close cap securely. Label specimen with patient details, date, and time. Place in biohazard bag for transport.
That wasn't too bad. Will I get results soon?
Yes, usually within 24 to 48 hours. I'll let you know as soon as they're ready. Meanwhile, we'll continue to use contact precautions just in case.